Health experts across the country are sounding the alarm on a new crisis to emerge from the pandemic. Treatment centers are seeing a surge in eating disorders, especially among young people. News 8's LaMonica Peters explores the reasons for the increase from UC San Diego's Health Eating Disorders Center.
Leaving a treatment center like last year in July and going into a world where there weren't jobs, where everyone was on lockdown, and that was very difficult.
Max Rodney is 21 now, but he says he's been battling anorexia since he was 12 years old. After experiencing feelings of depression and isolation during the pandemic, he made the decision to get back into treatment in May of this year.
Some of that just kind of compounded and got worse, and eventually I knew that I couldn't keep doing it on my own anymore.
The National Eating Disorders Association says it saw a more than 58% jump in outreach to its helplines in 2020, and that about a third of those contacts were people ages 13 to 17.
And eating disorders thrive in isolation. There can be a lot of secretive behaviors that take place.
The Health Eating Disorders Center for Treatment and Research at UCSD says because parents were forced to be home with their children during the pandemic, they couldn't ignore their child's eating habits.
Parents are catching it both quicker and or seeing what was maybe already happening, and now it's escalated, and so now there's no way around knowing what is really taking place.
McGlone says if parents notice something different in their child's eating, exercise, or social patterns, they should talk about it with their child. She says parents should also seriously consider getting professional help for their child or teen from a counselor or treatment center.